Hello everyone. It's April 2020 and we're still dealing with the COVID-19 pandemic. I want to personally wish all of you the best, whether you've been dealing with this medically or economically, and hope that we all can recover quickly. I know there's a lot of videos out there talking about the various issues regarding this pandemic. Most of them center around current treatment and prevention ideas. I want to talk to you real briefly about some very important issues regarding going forward. Now, we have to believe that this may not be the only pandemic that we will face going forward, and it certainly may not be the only pandemic that presents to us without some sort of vaccination option. So I would just like to talk about a few things with regards to that. Now, to break this down real quickly, there are the issues of treatment and prevention. And I'm sure most of you have heard about the various treatment options that are out there with the coronavirus associated with COVID-19. Now, there will be studies that go on throughout this year and even longer that will look at the effectiveness of the various treatment options, be it medications or supportive care in the hospital with oxygen and ventilators and the various combinations of those things. From a prevention standpoint, we heard a lot about the isolation, the shelter in place, and the personal sort of preventative measures using hygiene with hand washing frequently and face protection. I made a video about the various effectiveness of face masks for droplet prevention. So there are various issues with prevention. So when we talk about prevention from something like the COVID-19 disease, we're talking about the short-term preventative measures, which would be stay at home, wear your mask, wash your hands, or we're talking about a more long-term preventative approach. Now we're going to get into the discussion of immunity, and you've probably heard these terms mentioned several times. There's vaccine immunity and there's herd immunity. So when we're talking about vaccine immunity, this takes years to develop, and certain viruses were capable of developing some vaccines to offer immunity. With this particular coronavirus, there was not a vaccine available. Herd immunity is a different approach. It's when we look at providing some sort of immunity through our own immune system as we are exposed to the various viruses and other sort of illnesses in our environment. And we develop an immune system that protects us, and that's what I'd like to talk about today. So with the herd immunity, we're seeing that going forward into a future sort of pandemic type situation, we want to be at the best possible state to provide our own immunity and to provide the sort of immunity that allows us to continue in our society, and we will not have to face the sort of like isolation, shutdown things that we saw with this particular pandemic. So what we know so far is that we've been able to look at and classify the admissions throughout this country and others of patients that were diagnosed with the COVID-19 disease. And there are some commonalities that showed up quite often. In fact, most of the admissions, greater than 90%, were carrying one of a few related health conditions. We call these in medicine, we call these comorbidities. So the comorbidities that we were seeing with the COVID-19 that resulted in a hospital admission, these are not stay-at-home people that were testing positive that isolated in their home. These were people that were sick enough to be in a hospital. What we saw was that they had the risk factors of hypertension, cardiovascular heart disease, diabetes mellitus, or obesity. So over 90% of the people that were admitted that it had this disease to the point of needing hospital care had these conditions. So as we look forward to the best sort of prevention against the next pandemic, we need to take a long-term approach to how we can prevent these illnesses so that we are not vulnerable to the hospitalization. Doesn't mean we're vulnerable to the virus. It means that we could be the individual that contracted this virus and was able to stay at home and ride this out without any real significant serious illness. So what I want to talk about is we need to take a serious look at these type of health problems and how to prevent them, not just live with them. Now, I know you heard a lot of talk about big pharma and things like that came up often during this entire crisis. And I want to be very blunt here. In today's world with these type conditions, it's not acceptable to be a diabetic on 4 different medications to try to control your blood sugar under 150. Same for hypertension. If you're on so many medications, we need to look beyond that. We need to look at how we can use lifestyle and how we can use interventional tools that we have today to really prevent these type of conditions. And if we have them, what can we do to take them back into remission? There are excellent treatment options. We have very safe, minimally invasive procedures for the treatment of obesity, as well as the diabetes. And there are excellent treatment options for hypertension. And then we have this whole area of lifestyle modification. We know that a lot of the problems that developed in our society were a result of getting away from our healthy lifestyle choices, be it exercise or our nutritional diet. That our diet has really evolved in this country to a diet very rich in processed foods. So this is a big wake-up call for us to move back into a diet that's very rich in natural, organic food groups. Okay, we know that through a natural food group, we're going to have a better balance of our vitamins and essential nutrients that's going to make our immune system healthy. So this may not keep us from ever catching the next virus that comes through, but this can keep us from being into the hospital or having a serious problem from the next virus. I hope this information is helpful, and I wish you all the best success as we move beyond this pandemic.